forward in your new position, how do you think CHCS will continue to support and provide opportunities for innovation in public health and Medicaid, building off of what you already do and what you already have done?
Yeah, thanks, and great question. And, I'd say, sort of in some, more of the same and then some, right? So, since our founding back in the mid-90s, we have always maintained a core focus on advancing innovation in Medicaid. And that's our tagline. And we believe innovation comes in many forms, and that we have a core role to play in helping states and their partners always kind of push the envelope on opportunities to improve care and outcomes for Americans served through the Medicaid program. And this will continue in the months and years ahead under the new leadership of the organization. And we do this through a number of levers. Sort of first and foremost, we pride ourselves in keeping our finger on the pulse, as we say, of the most important and timely issues facing Medicaid stakeholders, whether at the policymaker level, the payer level, the provider level, or the community and consumer level. And by really, maintaining a focus on what are the most pressing needs of those stakeholders involved in Medicaid from their various vantage points, we sort of keep ourselves in a really good position to identify where innovation is most needed and to figure out what's needed to support design and adoption as well. So finger on the pulse is number one for us. Number two is continuing to cultivate a network of leading practitioners in the field. And again, whether it's policy practitioners, providers, payer partners, et cetera. But a network of individuals who are innovation oriented and always at the ready to test new approaches and to share lessons broadly with others. Those types of partners in the field are really our kind of bread and butter partners. We've been at this for decades now, and we have a pretty wonderful and growing network of partners out there who are an email or a phone call away when there are ideas at play of, how might we try something different or explore ways to reduce barriers in one form or another. Third, I would say, in terms of the levers that are core to how we go about this work, are creating opportunities for peer learning and exchange among those who are trying to solve problems in new ways. And so we run, any number of initiatives, whether at a regional level or nationally, where we are bringing together various stakeholders who are similarly organized around a particular problem and who may be testing different types of solutions or trying to overcome barriers in different ways, but who have a common purpose. And that purpose or that common barrier may vary from initiative to initiative. But really kind of accelerating learning opportunities by supporting that exchange and kind of rapid exchange of new ideas and best practices is a core strategy that we use. A fourth lever and related to that is really focusing on effective dissemination of what we learn. And so everything that we do in our work is focused on contributing to the public domain. And so whether we're working with individual organizations or we're supporting these types of learning networks or what have you, we are always going into that work with a mind to how can we identify sort of key insights emerging from this work and share them through as many different modes as we can with the broader stakeholder community. And whether that's, issue briefs or sort of written tools or infographics or webinars or other more innovative communication strategies, that dissemination focus is a core part of what we are trying to do, helping sort of spread the learning from one perhaps sort of early adopter setting to the broader kind of Medicaid universe. And then lastly, I think a core opportunity that CHCS has in the innovation space is through its work in building leadership capacity in Medicaid. So we work extensively with Medicaid directors around the country and with their teams to support their ability to be sort of next generation purchasers and to be the most effective policymakers they can be in driving improvements in the Medicaid program. And so through that platform where we have kind of direct access to supporting the ongoing learning and exposure of Medicaid leaders and their teams to new ideas, we have a wonderful opportunity to really support and if not catalyze, but to really facilitate efforts at the state level to really drive and advance innovation. And so we're particularly excited about that platform as well.
Thank you for sharing that. What are some of the emerging challenges that you're seeing in all of that work that you described, right? All of the efforts that you're working on with states disseminating the information and building that level of capacity. Where do you see challenges across, whether it be specific markets or nationally? And then I'll bridge this into the next question as well, which is, where similarly do you see the greatest amount of traction around building innovation? So both of those together.
Okay, great. Well, I'll start with the first one. And I'd say that in many ways, the challenges in Medicaid are the same as the challenges facing the broader healthcare market. But, given the unique demographics of the Medicaid population, as well as the constraints of public funding, these challenges are often more acute in Medicaid relative to other market segments, which frankly, from our perspective, just creates more opportunity and makes Medicaid that much more ripe for being kind of the frontier where this innovation should really be rooted. And so just to get more specific in terms of some of these challenges, clearly we're at a point in time of major transition in payment systems in terms of how we pay for healthcare services, transitioning away from a fee-for-service environment towards alternative payment methodologies that are really trying to focus more and provide greater incentives for value, right? And so as we try and fundamentally shift the entire way we pay for care in the healthcare system, we need to support providers in that transition, and we need to recognize that we're kind of in this sort of period of evolution where in some ways we're building toward the future, but we're still stuck in the present and sort of addressing and being mindful of that challenge as we go. A second challenge, and again, this is one you're very familiar with, is sort of given the increasing recognition of the role of social determinants in influencing health outcomes, figuring out what to do about it and what is the right way for the healthcare system and Medicaid specifically to intervene to more effectively address social determinants of health. And this gets to kind of what are the right interventions to pursue, and whom should healthcare entities and Medicaid stakeholders be partnering with at the community level, and how do we pay for these things, and what are the right incentives, and so forth. And then lastly, I'd say in terms of high priority challenges, the whole notion of how to effectively manage high cost populations is clearly a key area of focus for Medicaid as all payers in the system. Although I would say there are some key differences for Medicaid relative to other payers with respect to high cost populations. And in part, that's because Medicaid, unlike other payers, is responsible for long-term care, which drives a tremendous amount of cost in the system and includes very complex interactions and incentives across hospitals and nursing homes, for example, and various payers like Medicare and Medicaid. And so I think some of the dynamics around high cost populations are unique to Medicaid, but I think all aspects of the healthcare marketplace are clearly trying to figure out how to do a better job of providing effective services and improving outcomes for high cost populations.
There are obviously states that are focusing on this more than others, or have been, right?
Yeah.
Like New York with the disparate payment model and the new Bureau of Social Determinants. Obviously, what North Carolina has done in its new RFP and what it's building on its evolving fee schedule and SDOH payments. Obviously, what Arizona has done in increasing payment on transportation. do you see states that are building greater traction? And if so, then to the next question, what levers are they leveraging and where do you think it needs to be improved?
Yeah. Yeah, great questions. And I think you've highlighted some really great states in your examples there. Others that come to mind include Oregon, which through its CCO model, but just sort of, generally speaking, has been making great strides in really thinking about the incentive framework for its plan partners. Thinking about, how to use kind of varying degrees of profit sharing with plans to incentivize better performance on quality and efficiency. So I think that's been a really promising innovation for other states to be mindful of and to watch and potentially mirror as they think about the whole issue around, structuring managed care incentives in a way that aligns what we want plans to do and how we want plans to behave with the right financial support and incentives associated with that. North Carolina, you mentioned, is it's clearly a state that many are watching right now. Particularly in terms of its encouragement through its managed care procurement process of all plans using a single social service referral network, really, aiming to maximize scale, coverage, continuity of service. As the whole notion of social service referral networks is really growing in terms of interest and support around the country. North Carolina really stands out as a state that has aggressively used its purchasing levers to drive towards a statewide infrastructure there, which is very interesting and exciting to watch. And you mentioned Arizona. I might highlight them in a slightly different way. Arizona really stands out to me in terms of a state that has prioritized the integration of physical and behavioral health services, which is so critical to driving improved outcomes, particularly in a Medicaid population where behavioral health needs are so prevalent. And I love how Arizona has been taking a multimodal approach to this through financing strategies at the MCO level, as well as at the provider level, including a targeted investment program that's really designed to boost provider capacity to deliver integrated care. And so, across these examples, we see states really using their financing and purchasing levers to really think about where are investments needed in capacity building, and where do we need to change the incentives to really drive the behaviors that we're really looking for, and to make those investments make financial sense for partners, whether at the plan or provider level.
Got it. Thank you. What about, so what areas of new innovation are you most excited about? And where have you seen the emergence of really interesting solutions? And I mean, you spoke about how solutions are being integrated on the policy and payment side, which is really interesting. Mm-hmm. And sometimes the application itself, right, as in North Carolina, having a single statewide platform can build in a ton of value. But outside of the policy levers that states are able to apply, what about new technologies, new solutions, new companies in areas that you're seeing a lot of?
Yeah, I love this question. So a couple things come to mind for me. One is I'm really intrigued by the array of efforts through emerging technologies to improve member outreach and engagement, and using the member term from a plan perspective. At the provider level, maybe it's patient engagement, or at the state level, thinking about enrollees or beneficiaries. But regardless, some of the more interesting technologies in this area, from my perspective, are really focused on culturally competent engagement strategies and communication strategies. I'm mindful, and it's a core priority in our work, to really think about cultural sensitivity and to be mindful of really entrenched and persistent disparities in outcomes and in access to services. And until our system gets more tailored in its outreach and more mindful of cultural preferences for specific subpopulations, we're never going to get there, and we're never going to really address the inequities that exist throughout the system. And so the various technologies that are out there that are really trying to leverage culturally specific communications tools and low-lift communication strategies to really engage populations that have really been sort of outside of the mainstream of engagement efforts in the past, I think hold tremendous promise to really get at these goals of higher levels of engagement and improved equity throughout the system. So I love all the activity we're seeing in that area. And a second one that I'm super excited about are all the tools focused on addressing behavioral health needs. Obviously, we're at a time where there's tremendous focus on the opioid epidemic, but substance use is an issue well beyond opioids. And mental health issues are pervasive across this country and are particularly prevalent in Medicaid. And given all the stigma associated with seeking care for mental health issues, addiction issues, et cetera, emerging solutions that create a real important sense of privacy and comfort and make it easier for folks to seek the care they need, I think hold tremendous promise for increasing access to services that for as long as any of us have been around, have been highly underutilized and in many cases underfunded. And I think technologies hold tremendous promise to increase the access and availability of these incredibly important supports, again, both on the mental health and addiction treatment side. And I guess the last one I mentioned is we alluded to before are all of the efforts around social service referral networks. I mean, that's where probably the greatest amount of activity has been in this space from a Medicaid perspective. And I think the exciting thing there is, one of the things that's really needed to more effectively drive in both sort of investments and effective approaches to addressing social determinants of health are better bridges between the healthcare system and community partners. And these referral networks and the platforms associated with them hold tremendous potential to create that infrastructure and those bridges, whether for data or for other relationships or care coordination or otherwise, that are so necessary to support those partnerships. And that whole notion of partnership between healthcare and community is, one of the biggest and most important challenges our systems face right now. And so I think these tools have a really critical role to play in facilitating those collaborations.
So with those areas that you spoke about and your excitement around there, do you think that is an area that you would like to see more of when you give advice to early companies about focusing on those areas, or are there other areas that you would encourage them to look at, or are there mechanisms or processes that they should be looking at? What advice would you give to early companies that are even kind of earlier on that process around conceptualization of need in the Medicaid space?
Yeah, great question. So a few thoughts come to mind is, first and foremost, I would encourage entrepreneurs in this area to not be scared of Medicaid. I feel like Medicaid is a mystery to many folks who are not involved in healthcare directly or who are not policy people. And I think it can sound scary or intimidating. And I think there are many misconceptions about the Medicaid program in terms of whether or not it represents a viable business opportunity. And so I would really encourage folks to think about Medicaid as the segment of the market that in many cases has the most need and offers the ripest opportunities for partnership and frankly for return on investment. And so that would be my soapbox number one, is to really encourage folks to really explore the Medicaid landscape with high expectations for potential business opportunities there. A second piece of advice I would offer would really be to do your research. If speaking to the entrepreneurs themselves or the companies themselves, to really encourage folks to do their research to find the states and the Medicaid managed care organizations that are most innovation oriented. Like any market, right? Innovation is not evenly distributed, and an innovation mindset is not evenly distributed. And so readiness for these types of partnerships varies widely, but there are states who are out there who are quite ready. There are plans who are out there who are quite ready. And so doing your homework to find those who are the most ready to engage, I think is well worth the time and effort in doing so. And then the last bit of advice I'd offer is sort of whether it's in the areas that I mentioned before or frankly in other areas of interest or expertise, it's really critical to demonstrate that you know the people you're trying to serve. And I would just say that, you know, states and managed care organizations often feel a step removed from the day-to-day needs of their providers and their members, frankly, because they're operating at a level further removed from the community, from the office visits, from the day-to-day lives of the people that they are trying to serve. And so the more that companies can demonstrate a deep on-the-ground understanding of what these needs are and how their solutions can help, the more likely they are to effectively communicate their ability to fill a pressing need for the states and the plans that they're trying to serve. And so there's just no substitute for really knowing your market segment and really knowing on a very kind of detailed and granular level what those needs are and how your solution is going to help really meet those needs in a new way. Because the states and the plans don't pretend that they know all of that, and they are really looking for partners who can help them do that more effectively than they can from their vantage point.
Well, thank you. Thank you very much for these questions.